Good afternoon, everyone. My name is Judy Sikora. I'm the Senior Family and Community Engagement Specialist at Child Care Aware of America and part of our larger team at the National Center for Parent, Family, and Community Engagement, along with my colleague, Teresa Valdez-Bain, and on behalf of the National Center on Parent, Family, and Community Engagement, we're delighted to welcome you to today's webinar, where we'll be discussing the Implementing Child Care Resource and Referral Call Centers series of resources that are available to you. The series consists of a four-part set of resources designed to support child care and development fund lead agencies and their partners, such as child care resource and referral agencies, in setting up and or improving call centers as part of their consumer education and consumer engagement efforts. We originally had three facilitators for today's presentation. Unfortunately, Jennifer Drake cannot join us today, but I wanted to mention her because Jennifer Drake has had a huge hand in, she leads our team as the Director of Family and Community Engagement at CCAOA as part of NCPFCE, and she's had a huge hand in the development of these resources and also to the plan for the presentation today in the webinar. I've already introduced myself, so I'd like to turn it over to Teresa. Teresa, can you introduce yourself, please?
Sure. Good afternoon. My name is Teresa Valdez-Bain, as Judy said. I'm a writer associate at Child Care Aware of America. I've been supporting the work of the National Center on Parent, Family, and Community Engagement since 2015. I will have a chance to share some more about my background in a few minutes, so I will save the rest for then. Thanks. Judy?
Sure. Thank you, Teresa. So we're going to actually ask for some of your involvement today in the presentation. Not only will we be giving you information about this particular set of resources about call centers, specifically designed for CCR&R agencies, but we're also going to be asking a little bit about you. Let's talk a little bit about what we're going to discuss with you this afternoon. So in this webinar, during this webinar today, we'll be covering a number of topics that include offering guidelines and exemplary practices for use in the implementation of child care resource and referral call centers. We'll be providing you with some tools to support child care resource and referral call center staff and their supervisors. As I just mentioned, about that would be within the context of professional development. Those of you that are working to set up and improve your call centers as well. We'll also be offering you some considerations for the operation of a call center and ultimately supporting the work that CCDF administrators and CCR&Rs can do together to provide consumer education and also help parents connect with providers that meet their needs. So without any further ado, as Teresa hinted at when we had our introductions a minute or two ago, Teresa would like to speak with us a little bit and tell us about her experiences in a call center. Teresa?
Thank you, Judy. As mentioned earlier, I currently serve as writer associate. For 5 years previously, however, I supported the National Child Care Aware Hotline as a bilingual parent liaison specialist, where I provided referrals, consumer education, and engagement to families, calling for assistance to find child care and other resources. Supporting the call center and helping thousands of families over the years was very gratifying work. However, building the skill set to be successful did take time and dedication. For example, one of the tensions that I confronted early on was that of time constraints. While aiming to speak to as many families as possible to limit call waiting times and the number of families needing to leave a voicemail message, I also sought to provide excellent customer service through active and empathetic listening so that I could fully understand and respond to the family's needs, which for me meant taking extra time with each family. Over time, as I developed greater expertise in my role, I discovered how to strike a balance with both. Time constraints are a reality, and building rapport with families through strengths-based communication strategies to address their concerns can be realized as well. Today, we are excited to offer you a series of resources to support the effective operation of your call center and that of call center staff to serve families and children in your communities seeking child care and other related resources. Thank you for your dedication to enhancing your call center and to children and families across the country. Judy?
Thank you, Teresa. You know, it was when we were thinking about how to design the content for today's webinar, it was, you know, we were very cognizant of the fact that, you know, a lot of you that are on the line today and participating have a lot of experience, are working with call center teams, have been part of a member of a call center team, and know a lot about every aspect of call center operations. And, you know, we thought it would be really important, particularly because Teresa also had a very large hand in developing the content for the resources that we're sharing with you today, touching on them. So we thought it would be really helpful for Teresa to share her reflections based on her experiences. And I thank you so much for sharing your personal opinion on this, Teresa. And I also think it has just such important implications for the work that we do. What I cued in on when one of the things that you had said, the word that stands out in my mind is balance. And, you know, balancing the needs of the families, balancing the information that we really want to provide, the kind of information that we want to provide to families, but then also the really key important component of building a relationship and sustaining a relationship with families and listening to families, having great listening skills as well. So there's a lot required, and we're really happy that all you have also joined us today. So thank you, Teresa. As we begin, we just want to refresh your memory a bit about the 2014 reauthorization of the Child Care and Development Block Grant, as you know, also known as CCDBG Act, which expanded consumer education requirements for child care and development fund lead agencies. The resources in the series that we're about to share with you today address two parts of the expanded requirements. Section 98.32A, which requires lead agencies to establish or designate a hotline or similar reporting process for parents to submit complaints about child care providers. And also Section 98.33, which requires lead agencies to provide a consumer education website and additional consumer education information, which includes the availability of child care services through CCDF, other early childhood education programs for which families might be eligible, and also the availability of financial assistance to obtain child care services. In addition, other programs for which families receiving CCDF may be eligible, such as Temporary Assistance for Needy Families, TANF, or the Supplemental Nutrition Assistance Program, otherwise known as SNAP. Research and best practices concerning children's development, including meaningful parent and family engagement and physical health and development information, is also included. Policies regarding the social, emotional, and behavioral health of children, including policies to prevent the suspension and expulsion of children within the age range of birth to 5 years. In addition, information about developmental screenings must be provided. Developmental screenings must be provided to families during the CCDF intake process and to early childhood or school-age care and education programs through training and education. And developmental screenings must include the existing resources and services for the state, the territory, or the tribe that can provide in conducting developmental screening, and also in providing referrals and a description of how a family or provider may use those specific resources that are cited. Consumer statements that include how subsidies are designed to promote equal access, how to submit a complaint through the hotline, which that the reference number on that is 98.32, as which I just mentioned earlier. How to contact local child care resource referral or other community supports. health and safety, licensing, or regulatory requirements met by programs, the date of the last program inspection, and voluntary quality standards met by programs. We will provide a link for you to learn more about the 2014 Child Care and Development Block Grant CCDBG Act and the 2016 CCDF Final Rule at the very end of this training. In a list of resources section, we actually have several slides that will, and we'll explain each set of resources as we provide that to you, but that will be a little bit later on. Now that we've reviewed the requirements, let's take a closer look at the first resource in the series. Okay, so let's talk about the resources. As I said, we're going to be giving you samplings and nuggets of information, as you will, from some of the resources. Okay, so here on this slide, you're going to see a list of the resources that are in the series. There are 4 resources in this set. They are all designed to support child care and development fund lead agencies. As I had mentioned to you, this webinar, right, is designed for all of you and their partners as well, such as child care resource and referral agencies, in setting up and improving call centers as part of their consumer education and consumer engagement efforts. And I can't overemphasize that even if some of this information that we're presenting to you today you're familiar with, the resources provide that information that you may be familiar with yourself within a context that it can be used for professional development. It can be used for new hires, for call center teams, for all sorts of things. So there is a creativity element to these resources that we really encourage you to utilize because we created them for you to use as you see fit. So first resource, Implementing Child Care Resource Referral Call Centers, a guide for CCDF lead agencies and their partners. That's the first one. This is the primary guide in the series. And in the series of all the resources, all the other resources are either based upon or built on this resource. So this is another way you can think of it as an overview. It offers guidelines, exemplary practices, and tools for implementing child care resource referral call centers overall. It was developed for the Child Care Development Fund lead agencies and their partners, as we've mentioned. The second resource, Child Care Resource Referral Call Centers Operational Considerations. This resource is complementary to the guide. It discusses the nuts and bolts of running a call center. Some examples are planning the hours of operation, the phone and computer systems, staff coverage, and many more topics that have to do with that specific operational focus. It was also developed for the same audience. The second 2 bullets that you see on here, part 1 and part 2, that's a 2-part, those are 2 training webinars, and they're meant and intended for direct call center staff and their supervisors. Both of these training webinars, recorded training webinars, are based on the guide. That's the first bullet on your slide. They offer step-by-step how-to guidance, and they introduce each of the tools that you're going to find in the major guide, the first resource. And as I said before, we'll provide you with the links to these specific resources a little bit later on in our presentation today. Okay, now we're going to take a quick look at the guide. You're seeing on your screen what it looks like when you go to CCTA and you pull this down. This is what it will look like. This is visually how it will appear to you. And we're going to talk a little bit about how the guide is organized and some of the content that you're going to find in the guide. The guide is organized in 8 sections. The call center overview explains information the call center staff need to know and should be able to, and you're able to share, and describes types of referrals. The second section, Building Rapport with Families, explains consumer engagement, strengths-based communication, cultural and linguistic responsiveness, and listening to families. The third section, Referral Process from Start to Finish, That section describes the essential elements of making a referral. The fourth section, phone systems and phone etiquette. This includes how to use scripts and voicemail and how to return calls. The fifth section, considerations for other methods of contact, offers considerations for providing referrals face-to-face and by website, also by email, chat, and it also discusses instant messaging, IMing. The sixth section, considerations for developing consumer education resources, includes plain language tips. Section 7 is the operational considerations, which lists operational aspects to consider when setting up or enhancing a call center. And the final section is the tools. This tool section features 13 tools, 13 individual tools for operating an effective call center. They're numbered to make them easier for your own reference needs and purposes, and also to help you find them more easily. We'll discuss actually just several of these tools. We don't have time to go over all 13, but we've selected several tools that we'll be showing you briefly in this webinar presentation today. So here we have just a full list. As I said, there are 13 tools in the guide. We do not have time to go over all of them today, but we will be highlighting several of them, and they're all in the guide, which is online. I'm not going to read the names of all the tools to you, but you can take a glance and get a good idea of what we have here on the screen. From intake forms to sample scripts, intake scripts for health and safety or abuse concerns. You know, a lot of these tools and these resources are particularly helpful to you, as I said, when you're training new staff, or say, for instance, you're an agency and you're partnering with another agency who has an existing call center, and maybe you want to make sure that your goals with your partner agency are aligned for what results you want to see from your call center, from the work that is conducted in your call center. You know, these resources are very good for that, to make sure that you can agree upon the consistent use of some of these tools. And here is the second half of that list. So you can see all 13 tools. As I said, some of them are scripts, some of them are templates that you can duplicate samples of certain kinds of conversations that you want to have that would be appropriate and to engage families and to implement great listening skills and understanding what families' needs are. So now let's talk a little bit about call centers from an overview perspective. As we all know, parents contact call centers for a large variety of reasons, right? Families may be interested in general consumer education, such as what to look for in a child care program and how to search for a program. They may be seeking information about financial assistance programs, or they may be calling to report health and safety complaints, or in some cases, as we know, abuse allegations. Call center staff often are the first live contact parents have with early childhood and school-age care and education professionals and services. Staff, as you know, need to be prepared to respond to all the requests with information that is tailored to each family's specific situation. So your staff need to be prepared. Let's talk specifically about what call center staff need to know and be able to share with families. Call center staff need to be knowledgeable about a variety of topics that may interest families. We will discuss a few of these today, as I said, several, and you will find the full listing in the guide. Call center staff need to know and be able to share information about numerous things, including the availability of child care services provided through CCDF and the availability of financial assistance to obtain child care services. They also need sometimes information about quality rating and improvement systems, QRIS, accreditation, and other quality improvement initiatives, or research-based indicators families should look for when choosing a high-quality early childhood and school-age care and education program. Parents and families need information about other comprehensive services that families may be eligible for and interested in, such as Head Start and Early Head Start, state, territory, tribal, or local pre-kindergarten programs, energy assistance, Medicaid, housing assistance, and many, many more things. I'm sure you can add onto that list and make it much longer than I have. They should also be prepared to follow procedures for handling or referring callers who want to report a health, safety, or abuse violation to the proper agency. And this is a good place in our discussion to begin to clarify what we mean by actually a referral and look at the three different types of referrals. So let's do that right now. So a consumer referral provides parents with information and resources to best meet the strengths and the needs of their children and their overall family situation. Referrals may include helping parents identify and find high-quality childcare, connecting parents to family support programs they may be eligible for, such as TANF, Medicaid, and CCDF food programs, or linking parents to resources to document and file concerns about health, safety, and abuse violations. Now that we have a better understanding of consumer referrals, let's consider the other different types of referrals. We refer to three primary kinds of consumer referrals in this set of resources. The first is standard referral. A standard referrals provide families with customized information about child care programs. This information provided in this context of a standard referral is tailored to the family's individual interests, their strengths, and their needs. And of course, we all know that call center staff's ability to really listen and tune into a family communicating their needs is very essential with a standard referral. A standard referral typically includes a list of programs filtered according to the family's preferences, which would include hours, days of the week, location of the program philosophy, and much more, along with relevant consumer education information that is correlated with those family preferences. Most requests from families will result in a standard referral. So that's the majority of referrals that your call center staff are seeing, as you know, are standard. But then there's also enhanced referrals. Enhanced referrals provide families with additional services and information beyond a standard referral. An enhanced referral is when staff perform searches and they confirm vacancies in programs before they offer referrals to a parent. And not all call centers offer enhanced referrals, but it's important to know the distinction and the difference between them. Let's take a look at two tools that can support you when offering enhanced referrals. And now, as we mentioned, there are 13 tools in the guide, but we're going to show you just briefly here two different tools that really can support your call center team's work with enhanced referrals. Now, the first one that we're going to share is tool number 1. It's an enhanced referral intake form, and call center staff can use this template to develop an enhanced referral intake form. This is labeled number 1 in the guide, and right here you're going to see this is what it looks like. We don't expect you to read that. That font is kind of small, but we're just showing you what it looks like. So when you open up the guide and you see it, you'll recognize this. So it is labeled tool number 1 in the guide. It's a 2-page long template that can be used to develop your call center's own enhanced referral intake form. And the information it collects will support you in offering the parent and the family that you're speaking to with customized referrals. The next tool that we're going to show you is tool number 2. And this tool, this is called, it's labeled tool number 2, and it's tips for assisting families with children who have special needs. It's labeled number 2 in the guide, as it is here, and it provides tips for call center staff and their supervisors regarding examples of wording specific to assisting families with children who have special needs when offering enhanced referrals. So this is what it looks like. So when you look at it in the guide, this is what the template will look like. This is what you will see. As we mentioned, as you saw earlier, there are three different kinds of referrals. We've reviewed standard referrals, enhanced, and the third and the last type of referral that we will discuss today is referrals for health and safety or abuse concerns. These referrals provide information that connects families to the appropriate authorities to make a formal complaint about health and safety violations or child abuse in an early childhood or school-age care and education program. Handling this type of referral is an important service done by all call centers. Call center staff also may receive complaints or concerns from families about specific program policies or practices that do not directly impact health or safety. These complaints may be, for example, about program policies related to family visits during scheduled nap times, for instance, as an example, or another example of these kind of referrals would be continued tuition charges during absentee times. Those are just two quick examples that we're giving you. Tool number 3, we have 3 more tools to support calls related to health and safety or abuse concerns, which we'll take a look at right now. Here's tool number 3, procedures, and again, this is numbered the same in the guide. Tool number 3, procedures for concerns about health and safety or abuse concerns. This provides call center staff and their supervisors with exemplary practices to consider when developing or enhancing processes for handling calls related to health, safety, or abuse concerns. And this is what it'll look like when you see it in the guide. The next tool we're going to show to you is tool number 4, and this is the intake script for health and safety or abuse concerns. Number 4, it is a script that can be used by call center staff to identify and forward calls related to health, safety, or abuse concerns. This is what it will look like in the guide. As we mentioned earlier, call center staff are a very important first contact for families. Staff can enhance the first contact that they have with families by engaging them as consumers, using strengths-based communication practices, and demonstrating cultural and linguistic responsiveness and listening thoroughly and very carefully to the families they're speaking with. And right here you'll see on the screen, this is a simple graphic that just talks about consumer education. And any time or any way a parent interacts with a call center staff, it presents an opportunity to build on the parent's current knowledge. Of course it is, right? And reinforce the parent's role as the experts on their child and their family. One-way information sharing, which is a typical component of consumer education, is an essential step towards building rapport. It's one step, and I would like to emphasize that it is a good first step to beginning the relationship with families and beginning that very positive, thoughtful line of communication with families. And of course we know we need to build true rapport, right, with families, which goes much beyond providing information to them. Rapport requires two-way, mutually respectful interactions, and call center staff and parents share information with one another. They communicate well enough to understand each other's ideas, their values and opinions. When call staff build rapport with their families, what do they promote? They promote consumer engagement, which is really the overall goal. So consumer engagement relies on two-way relationship-based interactions between families and program level or system level professionals, including call center staff. And families and professionals share information with one another, and they work together to build each other's knowledge and capacities. When parents and families are engaged as consumers of early childhood and school-age services, they act as decision makers, and decision makers are individuals who are equipped with information, and they seek access to quality early childhood and school-age care and education for their children. They're also resourceful users of information and early childhood, school-age, and comprehensive services that support child and family well-being throughout early childhood and beyond, right? And then trusted peers. They act as trusted peers who help their friends and their families understand and connect with the highest quality options available. So, you know, the work that we do is also shared once we provide it to families. They share it with others. And also, too, as leaders who enhance program quality through leadership efforts in their child's program and their community. And, you know, there's no better marketing, right, than a satisfied family with child care services. And they will also not hesitate to help others in a variety of ways, as we know. As families expand their knowledge and leadership capabilities and their capacities, they can become more effective in finding and applying research-based information that informs their choices, because that's what we want to do, right? Inform their choices about a program for their child. This approach guides them in monitoring their child's experiences in a program, and it also strengthens their ability to use their voices to advocate for higher quality and equitable access to services. You know, of course, it starts with the call center staff listening to family voice, and then families can then in turn use their voice to help spread the good information and out to other families and many of their peers. And of course, we know as professionals, we expand their knowledge and capacities. They too can become more effective in inviting and responding to families' interests and values, and in supporting and partnering with families and other stakeholders. Here's an example. After talking with call center staff, parents may feel more prepared as consumers to make an informed choice about a program for their child. After talking with parents, call center staff may have a better understanding about what information is most valuable to particular parents and how parents prefer to receive information. You know, and we'll talk a little bit more about that in terms of preferred forms of communication, you know, and even all of us, right? Some of us prefer phone and email or text and email. You know, we develop our preferred forms of communication, and that's something that we need to listen to very carefully with families and try to respond to them in their preferred form of communication. You can learn more about consumer engagement, specifically through the Foundations for Quality series, a consumer education engagement series, which we're going to provide you the links for that information just a little bit later on in the presentation today. But we're going to keep going because we have a lot more information to share with you. So call center staff can enhance rapport and promote consumer engagement by using a strengths-based approach to communication and including strengths-based key messages in their interactions with families. A strength-based approach to communication, it involves a number of things, and here listed all the bullet items or all the things that a strengths-based approach includes. Acknowledging the strengths of families first, respecting and learning from differences, showing openness to adapting practice based on family preferences, shared decision-making, and an approach with families that's equitable and seen as reciprocal partners. Those are all very important to develop a strengths-based approach to your communication strategies. And using the strengths-based communication strategies can also go a long way toward the development of rapport with families and also to sustaining those family relationships. This topic is covered in the guide, and it's also covered in the training webinars as well. Okay, cultural and linguistic responsiveness strategies. As a welcoming partner for families, and very often the first live person that families are talking to about this topic, call center staff can ensure all families have access to information about early childhood, school age, and comprehensive services in many ways that are culturally and linguistically responsive and equitable. And when building a collection of consumer education resources, consider the diversity of the community in which you and your staff work. Language, ethnicity, literacy, and geography are all very important considerations. Providing resources that recognize, affirm, and showcase families' diverse cultures, knowledge, and experiences is really key. Call center staff and their supervisors can work together to ensure that the call center has multiple ways for families to access information. Referrals and materials and services are provided in languages spoken by the families and in ways that recognize families' preferences and cultures. And a couple of examples, just quickly. Choosing visual images that will encourage all families to feel included. Consider including pictures of children and families served by your organization, of course with written permission, that depict diverse cultures. Consider race, ethnicity, socioeconomic status, language, age, gender, sexual orientation, disability, religion, and family composition when you're making decisions about visual, audio, and also to written content. In addition to the communication strategies that are discussed, let's look now at other methods that we can use to connect with families. So other methods of contact with families. Families might prefer or use one of a variety of methods to contact the call center, right? We know this. Traditional methods include phone, as we all know, face-to-face, maybe a website, potentially social media, email, and also postal mail. Most recently, many families use online communication such as chat, instant messaging, and text. And each of these methods has its own set of considerations and are all discussed in the guide, every single one of them. So let's start with talking about the different considerations. Let's start with face-to-face contact and face-to-face referrals. If call center staff provide face-to-face referrals and consumer education to families, the locations of these centers should be convenient to families, right? For example, families need to be able to get there, right? Locating centers on or near public transportation routes, if transportation is available, or near other services that families might use, such as subsidy intake centers and other family support services. Just some considerations are, where would families be most likely to use a face-to-face option? Where can this service be provided? What hours of operation would be convenient for families? And do you have staff who speak the languages that are most often spoken by families in that particular area? And can these individuals be available at the locations where they're needed? Since families most often have a provider selected prior to completing their child care subsidy application, the location of consumer education subsidy intake helps to ensure that families are able to choose the highest possible quality of care that is available. For experienced staff and administrators, this guidance may seem basic, and I had said to a lot of you earlier, a lot of this is familiar to you, but for new staff or for organizations planning to open or enhance call center operations, or maybe partner with an organization who has an existing call center, this is all very important information considerations to discuss with others depending on your circumstances. So let's just briefly talk about considerations for website communications. The 2014 reauthorization of CCDBG, of course, as you know, requires state and territory lead agencies to ensure that information is available to families, early child and school age care and education programs, as well as the public, through a consumer education website. And CCDBG also requires that consumer education websites are made available through lead agencies and are equipped with zip code-based program-specific search functions, consumer education websites with robust search functions give families the flexibility to access information when it works best for them. And also, too, we have to think about time and schedule, so families can access it at times when it's convenient for them. In some states, lead agencies partner with child care resource or referral call centers for consumer education websites as well. In other areas, they are separate, and if your agency's website is not tied to the lead agency consumer ed website, consider how well your agency's website provides families with access to information and if enhancements are necessary. A quick example, the program search feature should be very visible and easy for families to access and also to navigate. And ideally, families should be able to access information without creating an account or completing a form to access information. However, sometimes some families, search criteria may require highly individualized information, and an information gathering form can be useful in customizing information for them. And in those cases, websites should offer easy ways to create an online account, complete a form, and provide the necessary information. You can learn more about website communications through the Foundations for Quality Consumer Education and Engagement series, which we've mentioned earlier, and which we'll provide you with links to at the end of today's presentation. So quickly, some considerations for online referrals. By that, we mean the list of providers a family receives when they do a program search on a consumer education website. And here are some considerations for providing a high-quality, customized online referral. Be sure to follow applicable state and federal privacy rules and regulations related to collecting personally identifiable information. Be sure to use plain language in the web pages, program search functions, in the referral resources or in the referrals themselves, and any follow-up customized consumer information packets. And plain language is also a topic that is discussed extensively in the guide, and we give a little bit more details to shortly. Have a customized request form that families can use to tailor their search. And after receiving online referrals, families submit a request for more information. Exemplary practice equates to a follow-up with a family within 1 business day. That's just an example. And lastly, ask for and use the parent's preferred communication method. That's just echoes to what we had mentioned earlier as well. Some considerations for email communications. Email's quick and it's easy. It's an easy method for responding to families, and it's a method that some families might prefer. We talked about family preference, right? And also to that balance that we talked about in terms of the information we want to share with families, provide to them, and exchange with them. So families generally expect to be sent a list of programs in their community. In the role of your call center, however, extends beyond emailing a list, and the staff can help families understand what to expect when requesting referrals via email. And here are 2 more tools to share with you. Tool number 5, and it's number 5 in the guide. The first tool that we're going to share on this topic is an email template for health and safety or abuse concerns. And this is what it looks like. It's labeled tool number 5 in the guide. And call center staff can use this template to respond to email messages related to health, safety, and abuse concerns. It includes a template for the response to the family's initial complaint as well as the reply email. That's what it's going to look like in the guide. Tool number 7. This is the second tool for referrals by email, and it is the Consumer Education Cover Letter template, and it's labeled number 7. Use this sample to develop your call center's own consumer education letter template, and this can also be included when sending a consumer education packet, referrals by postal mail or by email as well. So let's just talk a little bit now, light touch on call center operations. It looks like about 25% of you that are participating today were interested in that. We're just going to speak briefly about operational considerations. Child care resource referral call centers operational considerations. I'm jumping ahead a little bit here. This is what it looks like. And moving right ahead here, here's some of the areas and the topics that are covered. Regarding budget, some of the areas that are covered in the budgeting section of this guide are staffing, equipment, software, and by software, we're talking about phone software. We're not talking about computer software. Toll-free services, linguistic responsiveness, initial and ongoing training topics, general operations, indirect costs, and marketing and promotion. Next topic that's covered is availability. The availability section, it covers exemplary guidelines for the following categories: operating hours, easing hold times, and using comfort messages. How you deal with after hours. By this, we're referring to how you plan to handle calls that come in outside or staffed beyond staff operating hours. And then, of course, emergency preparedness and response. That's planning for operations in the event of an emergency or a disaster, or emergency closures or rerouted calls. It's important to make sure that call center staff are trained in these procedures, and it's always best to use actual experiences to validate existing procedures or to create new ones. That's an important point to consider as we look at professional development, right? And so the guide describes in the training webinars that I mentioned to you earlier that are part of this set of resources, they provide training for handling child care resource referral calls and calls related to health and safety complaints. Other training topics relevant for call center staff covered in the guide. What else is included is CCDF requirements for consumer education, including the consumer statement, child development considerations, and also too family well-being topics such as safety and health, financial stability, and supporting children and families experiencing homelessness as well. And this section includes ideas about additional resources that you might use for call center staff and professional development. In the quality assurance section of the guide, we offer exemplary standards to ensure that calls are promptly and accurately answered. For example, the Centers for Medicare and Medicaid Services call center standards require, and this is just an example from another resource, the average hold time may not exceed 2 minutes, and the average hold time is defined as the time spent on hold by the caller following an interactive voice response in IVR, a touch tone response system, or recorded greeting and before reaching a live person. Another element of this example of quality assurance is 80% of incoming calls are answered within 30 seconds. The disconnect rate of all incoming calls does not exceed 5%. And again, this is from the resource that we described here, the Centers for Medicare and Medicaid Services. This is what their standards are, their quality assurance standards are. Now let's look at the final set of resources. Implementing child care resource and referral call centers training. I mentioned this to you earlier. This is the facing slide of each one of the parts of the training. It's parts 1 and 2. They were developed specifically for child care call center staff and their supervisors to support the implementation and the implementation of call centers and the information about call centers that we present in the guide and that we've told you a little bit about today. It consists of 2 pre-recorded trainings that are designed to support your PD, your professional development for your call center staff. They're available for on-demand access. Part 1 runs about 54 minutes long and Part 2 is about 35 minutes long. And the content that's covered in these trainings comes exclusively from the guide, and it's been adapted for call center staff that has direct contact with families. As we're getting to close our time together, and I see that it's 4:01, so I appreciate your patience here because we had a lot of information to share with you. We hope you're able to gather some new information today and Maybe today's session also validated some of your strategies and some of your practices that you're already using in your agency. Circling back to why this training and these resources matter, as you can see from these quotes from families, and these are real quotes from families, high-functioning call centers and well-trained staff really do make a tremendous difference, and the work that you do every day is so very valuable to the families that you serve. And we really encourage you to find these resources. And on the screen right now, I have displayed the CCTA link to the suite of resources, call center series resources, the 2 trainings and the 2 guides that we've been mentioning and discussing. In a second, I'm going to flip the screen. We have more resources to show you. I don't want to flip the screen too quick in case you want to take a picture of that. And here are some more resources. The Foundations for Quality Consumer Education and Engagement series. That particular series has additional resources for you. More information about consumer education and engagement. You can learn more about developing and implementing effective family-friendly consumer education engagement strategies. That's above and beyond the specificity of call centers, which is what we talked about today. And those resources were developed by the National Center for Parent, Family, and Community Engagement. That's this center that's presenting the webinar to you today. And here are some additional National Center resources that are developed by our National Center for Parent, Family, and Community Engagement that really relate to today's topic of working with families, strategies for family engagement, attitudes and practices, and relationship-based competencies, all which are very relevant to the work that we do with families. And here are some additional resources on related topics as well. CCDF final rule, reauthorization. So we want to thank you for your time and your attention today. I'm sorry we ran a little bit over. I hope you found the extra 6 minutes and the hour that we spent together very valuable. We really appreciate your time as well and all the work that you do with families every day. And if you ever have any questions or want to send us an inquiry or a question, here's our contact information, the National Center for Parent, Family, and Community Engagement. Thank you so much, everyone, and have a great afternoon.